Well, feeling both numbness and pain might sound like an oxymoron, yet it's a very real condition known as neuropathy, and it can be both frustrating and debilitating for those who suffer from it. So here to explain his approach to treating it, we have Dr. David Walega with Integrated Pain Solutions, the sponsor of this segment today. Good to see you, doctor.
Nice to see you again, Robin.
I gave a very basic description, I think, of neuropathy, but for those out there, what exactly is happening that causes those sensations?
Neuropathy is a disease of the peripheral or central nervous system. This can be brought on by drugs or chemicals, like people who've had chemotherapy or radiation. They can have damage to peripheral nerves, resulting in these sorts of symptoms. One of the most common reasons to have neuropathy is diabetes. Diabetes afflicts about 10% of the American adult population, and many patients, even with really good medical care and maintenance of their proper medications and good glucose levels, they can still end up with this nerve problem.
Okay.
So quite debilitating. I mean, in mild cases, patients will have some mild numbness or tingling. In the more severe cases, patients feel like the distal extremity or the limb is on fire,
right,
or that the skin is just raw, even though it looks normal. So the typical approach is, treating with certain medications, but that doesn't always help patients. So one of the more advanced procedures that we have to treat neuropathic pain or neuropathy is spinal cord stimulation. So spinal cord stimulation is a method of treating nerve pain with electrical current instead of medications.
Okay.
So these electrodes are typically placed in the spine, in the space outside of the spinal sac. And these, if you look very closely, there's some little metal contact points on these leads or wires, and these actually conduct electrical current softly to particular tracts of the spinal cord, which then blocks pain-transmitting fibers from firing and sending the pain message.
Okay, and I was asking before this because I find this so intriguing, the results of this. What are patients saying, and what's the success rate if they're getting this done?
Yeah, so there are multiple reasons that we use spinal cord stimulation, neuropathy being one of them, chronic nerve pain from the spine or chronic sciatica, even in cases where patients have had corrective surgery, where they're left with nerve damage. In that population, we see that about 80 to 85% of patients with limb pain have profound results with spinal cord stimulation, so more than 50% pain relief in the vast majority of patients. But we still do a trial for about a week where we temporarily use the device and see whether it actually helps the patient or not before we would implant the full system. The implant actually, it's almost like a pacemaker, if you will. So there is an implanted battery here that is just tucked underneath the skin, very small incision, maybe 4 centimeters. This is what powers the whole system. So there are a variety of spinal cord stimulators out there on the market. The size of the battery is different depending on which one that you use, but can really be helpful in patients who've been suffering, who haven't gotten better with conventional means.
And is this often maybe in addition to surgery, prior to surgery? Does it matter kind of what phase people are in if they qualify for that?
It really depends. Certainly, if there is a simple corrective surgery that can be done to correct someone's spine or to repair a particular nerve, then we typically recommend that that's the best path. But there are many patients who already had the reparative surgery but still have the pain, or they have medical contraindications or reasons that they can't have surgery. They either have pulmonary problems, cardiac problems, can't withstand the vagaries of anesthesia or whatever. Sure. And so this is a good minimally invasive technique. And one of the great things about spinal cord stimulation is that it is done as a trial first. So you can actually test it out, see if it works before you commit to the actual implant being done more long term.
And neuropathy, obviously, and we've talked over the weeks, doctor, just one of the issues you treat. I mean, there are a lot of things that can go, awry, we'll say, within the spinal column, the back, the neck, right?
Absolutely, absolutely. So we brought Ron here just as an example so that we can see the wide expanse of the spinal cord from the base of the skull all the way through the lumbar region. Most commonly, patients are going to be having lumbar spine issues that may result in spine surgeries, but spinal cord stimulation can be used anywhere in the body. I've had patients in whom we've placed thoracic leads in cases where people have had shingles pain that has been refractory to treatment, patients with persistent nerve pain from other entrapment injuries of the upper extremity. So there are a lot of things that can be treated with spinal cord or nerve stimulation. And one of the great benefits is it's not a medication you have to take every day.
There you go,
and,
right?
You know, it's a long-lasting treatment.
And let's say if people are interested, they need to obviously go have a consultation, talk with somebody about the options. And it's great that there are so many now. ipscolumbus.com, or you can scan that QR code on the screen. So thank you so much, Doctor.
Great to see you again.